Hello everyone, my name is Warisa Panit. Today I would like to introduce you to the Global Health 101 by the research team from the International Health Policy Program. Our presentation will cover global health landscape, global health direction, global health platforms, and linking between global and local movement. Over the past 2 decades, the landscape has changed from the public health, then the emerging of international health, and then transformed into field of global health due to the rapid growth of globalization. What are differences between international health and global health? First, the scope. International health covers conventional healthcare issues, especially in terms of bilateral foreign aid activities, mainly for developing countries, while global health scope includes health and health-related issues like social determinants of health, trade, climate change, and health security. Next is actor, who takes a major role in the movement. For international health, most actors are government health sector technocrats, while global health actors are extended to other non-state actors like private sector, non-governmental organizations, foundations, and academia like universities. The last one is the influencing instruments. International health uses constitutions, regulations, or conventions to manage problems. Global health, however, tends to use other tools like financial and trade or soft laws such as resolutions, code of conduct, as well as guidelines and policy declarations. But what is global health? While there is no common definition of global health, in general, global health is the actions that require collaboration beyond territories of state and capacity of individual country. Involves all from government, communities, to foundations, NGOs, and private sectors for improving the health for all. This is why global health issues range from health to social determinants of health, which indirectly affect health. Simply, there are at least 5 metaphors that can be applied to global health area. These metaphors are used to transform complex policy trade-offs into strategies and principles. The first metaphor is global health as foreign policy. This metaphor rose from views of foreign policy using global health as tool to build alliance with other countries. Second, global health as security. Goal is to protect one's own population. This metaphor is focusing mainly on combating bioterrorism, infectious diseases, and drug resistance, including pandemic preparedness. Next is global health as charity. This aspect of global health involves with various allies, especially from non-governmental organizations, to fight against communicable diseases such as AIDS, TB, malaria, as well as poverty. Global health as investment. Investment is in this framework means to use health to boost economy such as medical tourism and development of new vaccines. Lastly is global health as public health. Goal is to decrease worldwide burden of diseases and maximize the potential health effects, such as promoting universal health coverage around the world. One of the most important global goals or direction is the Sustainable Development Goals or SDGs. The Sustainable Development Goals were adopted by all United Nations member states in 2015 as a universal call to action to end poverty, protect the planet, and ensure that all people enjoy peace and prosperity by 2030. The 17 goals are integrated, meaning that actions in one area will affect outcomes in others, and that development must balance social, economic, and environmental sustainability. For example, health is integrated in many health-related sustainable development goals, which are the numbered that are circled. Especially for SDG 3, which is to endure healthy lives and promote well-being for all at all ages. The targets of SDG 3 comprise of unfinished agenda from the Millennium Development Goals or MDGs, new SDG targets, and means of implementation targets. And SDG 3.8, focusing on achieving USC, becomes umbrella target of this goal. The World Health Organization or the WHO is the directing and coordinating authority in international health, including SDGs. The WHO leads global efforts to develop standards or quality of care with accompanying implementation guidance, as well as a measurement framework for assessing progress globally. The WHO began when its constitution came into force on April 7, 1948. There are now more than 7,000 staff working in more than 150 country offices and 6 regional offices and at headquarters in Geneva. The WHO works with various stakeholders, both member states and non-state actors, at global, regional, and country levels to create global health decisions and directions. Its governance takes place through the World Health Assembly, which is the supreme decision-making body, and the Executive Board, which gives effect to the decisions and policies of the Health Assembly. Now, what is World Health Assembly or the WHA? The World Health Assembly is the decision-making body of the WHO. It is attended by delegates of all the WHO member states and focuses on a specific health agenda prepared by the Executive Board. The main functions of the WHA is to determine the policies of the organization, appoint the Director General, supervise financial policies, and review and approve the proposed program budget. The Health Assembly is held annually in Geneva, Switzerland. The World Health Assembly includes various health stakeholders and actors in the meeting. List of delegates consists of Minister of Health from member states and their representatives, United Nations and related organizations, intergovernmental agencies, non-state actors in official relations with the WHO, and specialized agency. Outputs from the World Health Assembly adopted by member states can be categorized into 2 types. First, legally binding agreement, which is the legal contracts that can be enforced by law, such as International Health Regulations, or IHR, or the WHO Framework Convention on Tobacco Control, or FCTC. Second is non-legally binding agreement. This type of output would provide guidance for member states and the WHO Director General for further actions. Examples of non-legally binding outputs include resolutions, decisions, guidelines, global strategy, and global action plan. How to link global movement to local movement? There are 2 perspectives to explain this linkage: inside out and outside in. The first perspective is inside out, that countries share their good lesson learned to other countries in order to drive the agenda at global or regional level. Let's use Thailand's experience as example. For inside out, universal health coverage or USC in Thailand is a good example. Thailand has driven agenda of USC in various platforms. Thailand achieved USC in 2002 and plays active roles in promoting USC at global and regional level using our extensive experiences. Thailand joined the Foreign Policy and Global Health Initiative or FPGH in 2007, and the FPGH plays active role at the United Nations General Assembly, which is prime global platform. Every year, FPGS proposed the resolution at UNGA. In 2012, the UNGA 67, FPGS proposed USC resolution on 12 December. Consequently, in 2017, when Thailand was the chair of FPGS proposed two agenda which were adopted by UNGA. The first resolution decided to proclaim 12 December as the International Universal Health Coverage Day, and the second resolution decided to hold a high-level meeting in 2019 on USC. In late 2018, Thailand proposed additional agenda preparation for the high-level meeting of the United Nations General Assembly on universal health coverage to be discussed at the Executive Board meeting in early 2019. The agenda was accepted. The output from the Executive Board meeting in January 2019 was the resolution of preparation for the high-level meeting of the UNGA on USC, which Thailand and Japan co-chaired in drafting the resolution. At the WHA 72 in May 2019, the resolution was adopted. This would be used as one of the inputs in the developing political declaration at the UNGA, which is the output of the high-level meeting of the UNGA on USC in September 2019. The development of the political declaration was co-facilitated by Thailand and Georgia. This is how Thailand share our experience and drive USC agenda in various global platforms, or inside out. The second perspective is outside in. This means the country uses global resolutions, guidelines, or other countries' experiences as reference to drive their own national policies. Promoting of breast milk substitutes in Thailand is a good example. Since 1981, Thailand has tried to adopt the International Code of Market Breast Milk Substitutes or Milk Code from the WHA to national voluntary measure. However, it has not successfully done as it should be. In 2010, during the WHA 63, the WHA resolution urged member states to develop and strengthen measures to control the marketing of breast milk substitutes. With a resolution from the global platform, Thailand took this as a reference in driving agenda at our National Health Assembly in 2010 by urging the Ministry of Public Health to develop national legislative measures. In 2016, the drafted law was submitted, but some national stakeholders require further evidence to support the legitimacy of the law to control the marketing promotion of products for children aged under 3. Thus, Thai delegates took the WHA 69 as a platform to draw support using the WHA guidance as a reference to support its position to control the product, including those for children aged under 3. Finally, in 2017, with reference from the WHA 69 resolution, draft law has been approved and enacted with the maximum scope to control the marketing of breast milk substitutes. This is how Thailand used the WHA resolutions as reference for national movement or outside in. And this is a brief overview of global health. You can find more in-depth information on global health from our Global Health Resource Center on our website. Please visit our website and social media. Thank you very much for your attention.